Have you ever secretly wondered, is it really possible to make my penis bigger safely? Why does my urine sometimes spray in two directions, such as a broken garden hose? Or why do I lose my erection as soon as I start overthinking? If you have, you're not alone. These are some of the most common and least talked about questions I hear from men every single week. I'm Dr. Fiona Gray, sexologist and urology expert. And today, I want to tackle these questions head on. Because let's be honest, the internet is full of half-truths, myths, and marketing gimmicks designed to make you feel insecure. And my job is to cut through all of that with real science, real clarity, and zero judgment. So make sure you hit that subscribe button and turn on notifications, because we're having the honest conversations about men's health that most doctors won't touch. Drop a comment below and let me know where you're watching from. I love seeing men from all over the world building this community. Here's what we're covering today. First, why psychogenic erectile dysfunction, losing your erection because of overthinking, is so common and how to reverse it. Second, whether adult film performers are naturally that big or if there's more going on behind the scenes. And third, why your urine sometimes sprays or splits, plus when to relax and when to get it checked. By the end, you'll have not just answers, but a clear action plan for your own health, confidence, and peace of mind. Let me bust 3 big myths right away. Myth number 1, if you lose your erection during sex, you're broken. Truth. Most of the time it's not your body failing. It's anxiety creating a mental block. And yes, it's reversible. Myth number 2. Adult film performers are proof that your size isn't enough. Truth, what you see on camera is a combination of natural outliers, camera tricks, and sometimes medical aids. It's entertainment, not reality. Myth number 3. A split or spraying urine stream always means something seriously wrong. Truth, in many cases, it's something temporary and harmless. But sometimes it's a sign your prostate or urethra needs attention. So instead of shame or worry, let's replace these myths with understanding. Because clarity is the first step toward confidence. Question number 1. Why do I lose my erection when I start overthinking? This is one of the most frequent questions I hear from men in their 20s, 30s, and even 40s. Here's the biological explanation. Erections depend on a balance between your brain, your nerves, your blood vessels, and your hormones. When you're relaxed and aroused, your brain sends signals that tell the blood vessels in your penis to open up, filling with blood and creating firmness. But when you're anxious, analyzing every sensation, worrying about what if, your brain shifts into stress mode. Stress hormones such as adrenaline tighten blood vessels, block the flow, and interrupt those signals. The emotional impact is significant. The first time it happens, it feels shocking. The second time, you start dreading it. Soon, the fear of losing your erection becomes the cause of losing your erection. It's a vicious cycle that can steal confidence, intimacy, and peace of mind. So here's the practical solution. First, rule out medical causes. Even in men under 40, about 1 in 8 cases of ED are linked to underlying conditions such as early cardiovascular disease. Because the arteries in your penis are smaller than those in your heart, erection issues can sometimes be the first warning sign of deeper health concerns. So always get checked. Second, if your doctor rules out medical problems, focus on breaking the anxiety cycle. That might mean working with a therapist who specializes in sexual performance. It might mean temporarily shifting your focus away from penetration and toward touch, intimacy, and sensation without pressure. And in some cases, your doctor may prescribe a low-dose erectile medication, such as tadalafil. These don't create arousal, but they can make it easier to maintain an erection while you rebuild confidence, breaking the cycle of stress and failure. So yes, psychogenic ED is real, but it's also highly reversible. The key is addressing both the physical and psychological sides together. Question number 2. Are adult film performers naturally that big? Let's talk about size, the elephant in the room. Here's the biological reality. The global average erect penis length is about 5.4 inches. Roughly 99.7% of men fall under 7.2 inches. That means what you see in adult films represents a tiny fraction of men, and that's before camera tricks are added. The industry truth is this: adult entertainment selects men who already have above-average size. On top of that, directors use angles, lighting, and even vacuum pumps right before filming to exaggerate appearance. Some performers may also use fillers for girth, traction devices for small gains, or medications and injections to maintain erections during long shoots. A few have implants, not for size, but for erectile dysfunction. The emotional impact of this comparison is real. Comparing yourself to adult film performers is such as comparing your weekend jog to an Olympic sprinter on performance-enhancing drugs. It's not real life, and it's not a fair measuring stick for your self-worth. Here's the practical takeaway. Real intimacy isn't measured in inches. It's measured in connection, confidence, and communication. And science shows most partners care far more about presence and passion than about size. So next time you catch yourself making that comparison, remember that adult content is performance, not reality. You're comparing yourself to a highly edited, carefully produced fantasy that doesn't represent normal human anatomy or sexual experience. Question number 3. Why does my urine sometimes spray or split? This one surprises men because it feels so random, but there are clear reasons. Here's the biological explanation. Think of your urethra as a hose. If the opening is clear, urine flows in one direction. But if something temporarily blocks or narrows it, such as dried semen after ejaculation, inflammation, or an enlarged prostate pressing on the tube, the stream can split, spray, or change direction. The emotional impact is real. It's embarrassing. You start feeling such as you can't control something as basic as urination, and that can affect dignity and confidence. Here's the practical solution. If it happens occasionally after sex, it's usually just leftover fluid in the urethra and nothing to worry about. If it happens frequently, especially with a weak stream, straining, or stopping and starting mid-flow, it could point to benign prostatic hyperplasia, BPH, or more rarely, a urethral stricture. Both are treatable, but they require evaluation. A simple short-term strategy? Try sitting to urinate. It may sound unusual, but in many countries it's common, and it can help control the direction and reduce mess. So yes, spraying or splitting is often harmless. But don't ignore it if it's persistent. Your body may be signaling a deeper issue. So what should you do with all of this? If you're losing erections from overthinking, see your doctor to rule out medical causes. Then focus on rebuilding confidence through therapy, intimacy exercises, and if needed, short-term medical support. If you're comparing yourself to adult film performers, stop using entertainment as a benchmark. Remember the reality of averages and focus instead on connection and confidence. If your urine stream is splitting or spraying, don't panic if it's occasional, but do see a urologist if it's frequent or paired with other urinary symptoms. And for men, over 50 especially, supporting your prostate health can make a huge difference. That's why I recommend Prostapeak, a supplement that combines saw palmetto, pygeum, green tea, cat's claw, raspberry, and soursop. These ingredients are shown to help reduce inflammation and support healthy urinary flow. You'll find the link in the description if you'd such as to try it. Let me remind you of something important. Struggling with erections, worrying about size, or noticing changes in your stream does not make you less of a man. It makes you human. Your body changes, your mind plays tricks, and sometimes your health needs a little extra attention. That doesn't mean you've failed. It means you're alive, evolving, and capable of adapting. The men who struggle the most are the ones who stay silent, bury their questions, and never seek answers. You're already a step ahead simply by being here, listening, and learning. So here's what I want you to take away today. Erections that falter under pressure are common and reversible. Adult content is entertainment, not a blueprint for real life. A split urine stream is often harmless, but always worth checking if persistent. Your health is not about shame. It's about understanding. And with the right knowledge and small daily actions, you can reclaim your confidence, your comfort, and your vitality at any age. If this video gave you clarity, hit that subscribe button. Share this video with someone who might need to hear it, but is too embarrassed to ask. And in the comments below, let me know what's one healthy habit you're starting this week to support your body. Your health is your responsibility, but it's also your power. Take care of yourself, because you're absolutely worth it. Thanks for watching.